It feels like only a minute ago I was right here. We're here to share what I think may be another MedX first this year. We've wanted for some time to co-create while we're in this space together, and we've been looking for the right opportunity and the right time, and this year felt like it for a number of reasons. This year in particular, as our country and as our healthcare community begins to think about research in new ways, we heard about that this afternoon for sure, that's been a seminal theme of this event. We wanted to think about, through the MedX lens, what it looks like to build patient-included research. So some of these themes may feel familiar from just a few moments ago. We literally built this process, as the old joke goes, like building an airplane in flight. We started only a few weeks ago putting this idea together, and we did it pretty quickly, but we did it so that we'd have a chance for everybody that wanted to in this space to contribute while we were together this week. And we'll tell you a little bit about how we did that. But what we really wanted to do was tap into what makes Medicine X uniquely Medicine X. It's that idea that in the same room, on equal footing, you get researchers and academics and doctors and patients and technologists and designers, all working together, all with the same voice. And when I thought about that, I thought it sounded a little bit like this. This was apparently from last night. I think it's very fitting, right? So what happens when you get two people that maybe have slightly different backgrounds doing something really wonderful together? In this case, we had hundreds of people of different backgrounds doing something very wonderful together. We started, and many of you contributed, we had over 50 or 60 contributions to our survey by sharing your thoughts on what does research even mean? And you'd be interested and maybe not surprised to know how profound the variances in those responses were. We also asked questions like, what does it look like to value patients as participants? What things would make research feel like it was patient included? And we did that again through a series of interviews. Some of you participated in those. We did over 12 or 15 direct interviews, and we are grateful for the people who agreed to interview and the people who agreed to be interviewees. Thank you very much. And in some cases, it was a dialogue. Some of the people who were interviewers got interviewed. It was fantastic. So we took that, and we decided to bring a group together. We literally did this morning. We did it only a few hours ago. We came together for about 2.5 hours, and we reviewed all of the responses from the surveys and all of the input and feedback from those interviews, plus the expertise of the people in the room, and started to synthesize. We took that from big, disparate ideas down to clustered themes, and we kept going smaller and reducing that down until we got to a set of design principles. And for us, design principles are what we're saying should be true for research to be done in a way that is Medicine X, patient-included research. Think about this like the Better Housekeeping seal. What things have to be true to get that seal? Or if you were building a house and you said to an architect, I don't care what it looks like, but the master bedroom must be on the first floor, that's a principle. So that's what we set out to do, and we did it in a pretty short period of time, and we're excited to share those patient-included design principles with you. I'm going to turn it over to Claudia.
So those of you who have practiced Lean Startup know that the goal is to get an MVP in front of people for input as soon as you possibly can. And so here what we're trying to do is, this is the cardboard prototype, to which we hope to get lots of input and eventually see where that MVP is headed. So these are the sort of bones of what came out of the discussion this morning. So patient-included research honors and includes all members as full partners in the research team. Now, interestingly, we started with honors and includes patients. But as we talked more, we realized it's not that. It's that people have different roles. Everyone is an equal partner. And so a distinct part of this is recognizing that people's functions and roles and expertise is different, but we need a process and a goal of honoring and including everybody. Patient-included research is open source, where methods and data and purpose are shared, and where there's a feedback loop of data and results to participants, to the public, to everybody. Patient-included research helps patients make decisions. And we'll get to purpose in a little bit, but it puts the results in it doesn't say in abstract terms, we found this little bitty thing that we think might be relevant 10 years from now. It says, if you are someone reading this and you are making a decision, here's how this might affect that decision that you need to make. It benefits researchers. Now, obviously, they're included as full partners in the team, but there is a history and reasons for the decisions that have been made in the past. We are not looking to throw those out. We are looking to embrace and honor all of what has come before, while, as Susanna so eloquently said, to watch the game and see the marching band at the same time. Patient-included research is proactively designed for inclusion. History has not shown us how to do this. And we need to use all of our creativity and relationships and community so that no one is left out of the equation, and so the results are relevant and feel important to everyone. Patient-included research evolves as researchers and patients learn together. It's agile, it's iterative. This is a tricky one because that is not how IRBs work. But we need to find a way to iterate in the context of a given study and in the context of research over time as well. Now, this one, Nick and I probably spent the longest trying to figure out, is this the right one? We're not sure this is exactly the right one. But what we mean is we make core decisions about priorities and about funding those priorities based on what's important to patients. And we heard that so eloquently about Parkinson's. The priority for them was not on tremors, it was on fatigue and gastrointestinal problems. So let's put our money where our mouth is and fund and prioritize based on what matters to patients. Patient-included research is well designed. Now, a researcher might say, sure, I have the perfect methods for you. We don't mean just methods, we mean process. And there's a core concept of simplicity. Not that we can't have complex goals, but if we don't make the experience beautiful and engaging and seamless, and not just for the participant, but also for the researcher and for everyone involved, we're not going to succeed. Those are the beginning. That's the cardboard prototype, and I think the next phase is to really figure out how to get input from all of you. And I just want to give a round of applause to all of you who participated in this process and who will in the future, so that's all of you, and who met us this afternoon as well. So thank you so much.